This is Radio Health Journal. I'm Nancy Benson. This week, a new report looks at the state of the world's children.
In almost all cases, in almost all countries, those statistics, those enders of childhood, have gone down for children.
How the U.S. rates against the rest of the world in how we protect our kids, when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
This week on Viewpoints.
Education matters. Sort of this gift of education is one of the greatest gifts you can give someone to change their situation.
John Urschel rose to the top of two completely different fields. Coming up on Viewpoints, why he left pro football to pursue his PhD in mathematics at MIT. Then,
they kill something like 2 million rats, which is 5 times the city's human population.
The history behind the first U.S. case of the plague. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
We all want to protect our kids from the things that take childhood away. Things like dropping out of school, child labor, teen pregnancy, and malnutrition. We may think we're doing a pretty good job as a nation compared to the rest of the world, but are we really? The humanitarian organization Save the Children creates a yearly scorecard of more than 175 countries to find out.
We wanted to look at what makes for a good childhood for kids. So we have these 8 indicators, and they include things like child survival, so surviving to the age of 5, getting into school, staying in school, harmful things like child labor or early marriage, child homicide. These are things that end childhood if they happened for children.
That's Carolyn Miles, CEO of Save the Children. She says the yearly Global Childhood Report tracks changes over the lifetime of today's 18-year-olds to predict how likely each nation's kids are to grow up healthy, educated, and safe.
What's really exciting about what we saw in the report was that in almost all cases, in almost all countries, those statistics, those enders of childhood, have gone down for children. So there are 280 million children who have a better childhood, start at a childhood today than did back in 2000. And so that says kind of with one generation of children, the world has gotten much, much better for 280 million children, which is an awful lot of children.
And Miles says some of the changes are extraordinary. Improvements that didn't seem possible a generation ago.
49% drop overall in under 5 deaths, for example. 25% drop in child marriages. This is all just in this 18-year period. 33% drop in chronic malnutrition and stunting of children. So lots of really good outcomes. And I think what was also heartening to me was it was in some very poor countries. So it wasn't just in wealthy countries where you saw this better outcomes for kids and a better childhood for children. It was also in really poor countries.
However, while childhood is improving for 280 million kids around the world, nearly 700 million others are in danger of having their childhood stolen. More than half of those are a result of war.
There were only a few countries that didn't get better over the 18 years. 2 of them I would pull out. One is Syria, and that is a country that was a middle-income country in the year 2000 before the recent war, which has now been going on for about 9 years. That country is now seen very significant increases in malnutrition and children out of school, in displacement, obviously, of children and their families. So that's a example of where when a war happens, even a country that's making real gains goes backwards. The impact of war and conflict, I think, is probably the flip side of the good news in this report, is that statistic has really gone the other way. So there's a 80% increase in the number of displaced people since the year 2000, and half of those are kids.
As for other conflict zones, Miles cites Venezuela and Yemen, where more than 85,000 children have died of malnutrition since the start of its civil war in 2015. Those countries are all toward the bottom of the worldwide rankings. The nation that's number one in protecting children is Singapore, followed by Sweden, Finland, Norway, and Slovenia. Germany, Ireland, Italy, and South Korea are also in the top 10. The United States, we're number 36, tied with China and just above Russia. But we're getting better.
Two things specifically that we saw, again, over the 18 years. One is school dropout rates, and so that number is down by almost 2/3. And the really good news is you're seeing the increases, particularly for young Hispanic youth and African American youth. So that is actually a good thing. So the inequities are narrowing in the U.S. And then the other thing is a drop in teen pregnancy. And so I think both of those, that's about a 56% drop in teen births in the U.S.
That's certainly a good thing, but Miles says you might consider the glass to be just half full.
If you look at the rest of the world and you look at this 18 years, the speed at which, for example, China has improved their scores in these measures, it's much faster than the U.S. has improved theirs. And so we're slowly getting better, but a lot of countries are getting better much more rapidly. And I don't think in the United States we prioritize the issues for children nearly enough.
For example, Save the Children does a great deal of work in this country trying to get 4-year-olds into preschool programs, including Head Start. Their success is mixed.
In the United States, more than half of all preschool-age kids are not in school, and that's about the same as a decade ago. There are many, many kids that are living in rural communities who don't get into Head Start programs, and that's typically a state-by-state effort. So we actually have been working state by state, particularly in the poorest states along the southern third of the U.S., and trying to make sure that those states really prioritize pre-K. And it's not going as quickly as it should be going.
So how can we push along the process to improve the lives of children? Miles says it's a matter of commitment in other countries that are doing well.
The investments that they're making in children, I think, are quite substantial. So a big part of this is making kids a priority and saying we care about our children not dying of things we can prevent. We are making sure that every child is actually in school. We're making sure that teen pregnancies are very low. So I think those are the things that really makes a difference. And we talk about 10 factors in the report that drive change. And one of the most important, I think, is commitment from governments that kids matter.
You can see the entire Global Childhood Report at SaveTheChildren.org or through a link on our website, RadioHealthJournal.net. You'll also find archives of our programs there, as well as on Apple Podcasts, Google Play, and Spotify. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Family members are typically the first to notice memory issues or cognitive problems in a loved one, but they're often hesitant to say something. A new survey released by the Alzheimer's Association, however, reveals that nearly 9 in 10 Americans would want others to tell them if they themselves were showing signs of memory loss, thinking problems, or other symptoms of cognitive decline. This month, during Alzheimer's and Brain Awareness Month, the Alzheimer's Association and the Ad Council are launching a new campaign, urging people to notice the signs and start a conversation. Ruth Drew is Director of Information and Support Services for the Alzheimer's Association.
Alzheimer's disease is challenging, but talking about it doesn't have to be. We say follow the ABCs, assess changes, begin a conversation, and contact the Alzheimer's Association for help.
For information on the campaign and resources to begin this important conversation, visit alz.org/ourstories.
Paid non-attorney spokesperson Fierce Nakawati with principal office in Dallas, Texas. Attention landscapers and anyone working in the landscape industry. This is an important alert for users of the weed killer Roundup that have been diagnosed with non-Hodgkin's lymphoma. A California jury recently awarded $289 million to a landscaper who claimed Roundup gave him cancer. Roundup is the most widely used herbicide in the United States with billions of pounds applied each year. Farm workers and landscapers are at the highest risk of injury from exposure. Time is limited to file a claim. If you work with Roundup weed killer and were diagnosed with non-Hodgkin's lymphoma, don't wait. Call the Roundup Legal Helpline now. The number to dial is 800-208-0501. That number again is 800-208-0501. You could be entitled to significant compensation. If you've been exposed to Roundup and have been diagnosed with non-Hodgkin's lymphoma, don't wait. Call the Roundup Legal Helpline right now. 800-208-0501. That's 800-208-0501. Again, 800-208-0501. Call now.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.